Hello viewers, hope you all are fine. So today's topic has been taken from child health nursing, which is mainly focusing on the group age of newborn and infants. As you already know, bottle feeding is the biggest killer among all the diseases. So in order to resurrect the dwindling practice of breastfeeding, in order to bring back the practice of breastfeeding which is diminishing day by day, an initiative has been launched which is named by BFHI, Baby Friendly Hospital Initiative, which is launched jointly by WHO and UNICEF, World Health Organization and United Nations Children's Emergency Fund in March 1992. This BFHI aims to improve the knowledge, attitude and skills of healthcare staff to promote the breastfeeding practice by providing them skills and attitudes for the caring of infants aged up to 6 months. So this BFHI consists of 10 steps, and further if we'll talk about the stats of BFHI, to the date there are 19,000 hospitals and 19,000 hospitals in 125 countries. Further there are health centers also who had received the designation of baby friendly hospital. We'll go back to the 10 steps. So these steps are like minimal global criteria to attain the status of baby friendly hospital. Step number first is they should be having written breastfeeding policy which should be routinely communicated to all the healthcare staffs. Why to have a policy? If we'll have policy, because sometimes we require course of action. If we'll be having policy, we know how to go, how to move on further, and then we'll be having guidance also. If we'll be having policy, so we'll have like evaluation criteria, we'll be having standards to evaluate something, and then there'll be consistent care which will be providing to all the mothers and all the babies. Now what this policy should contain? This policy should contain all the 10 steps which should be written in local language or either English, which is understandable to all the patients, patients as well as mothers, and then healthcare staffs, and it should be given to all the healthcare staff which are caring for mother and babies, and then it should be available in the maternal areas and child care areas. Further, there should be training to all the healthcare staffs and skills which are necessary to implement this policy. They should be trained about how to expel the milk, what is the correct positioning, what is the attachment to the baby and mother, what are the risks for artificial feeding, what are the benefits of breastfeeding. They should be trained about all the skills and this knowledge. Further, there should be information which is given to all the pregnant mothers about the benefits of breastfeeding as well as management. In benefits, we have to tell them about this health education should be given during the time of antenatal period in order to avoid the complications during that after birth. So this education should contain risk for artificial breastfeeding, benefits of breastfeeding, how to care during the time when we are caring for babies, when we are breastfeeding the babies, how to care for babies, what is the correct position, what is the correct attachment. And this antenatal education must include the correction of retracted nipple, sore nipple, cracked nipple, and it should be treated in antenatal period only. This antenatal education must not include the group education about supplementary or formula preparation, because if we'll tell everybody about the formula preparation, so people won't be going for exclusive breastfeeding. So we have to avoid this formula preparation point. Further, we have to help the mother to initiate early breastfeeding within half an hour of birth. We have to initiate early breastfeeding in order to have proper attachment. Baby will be having colostrum as their first immunization. They'll be getting warmth. There'll be maternal orgasms also. The mother will be also having maternity feeling. Further, there are like many of the less complications which is delaying or which is not happening. Then we have to show mother how to breastfeed and how to maintain lactation if they are far away from the infants. So how they can maintain lactation? They can collect the breast milk with the help of breast pump or any other thing. They can collect the breast milk and they can keep it for some time, and further they can breastfeed the infants. So this is how they can maintain the lactation. Next step is there should be avoidance of giving of food, drinks other than the breast milk to the newborn infant unless it is medically indicated. We should strictly avoid giving foods and drinks to the newborn or infants unless it is medically indicated, in the sense if there are any complication or the mother is suffering from any serious illness or serious disease, this substitutes, milk substitutes, breast milk substitute, artificial feeding should be strictly avoided. Next step is we have to practice the rooming in. We have to allow the mother and the baby to remain together round the clock or 24 hours. We have to allow them. So there will be like maintenance of body posture. It will reduce cost. It will reduce equipment supplies also. We don't need any other person to care for a baby. So there are many advantages if we'll go for rooming in. Further, we have to encourage the breastfeed on demand. We don't have to watch clock and then we have to breastfeed the baby. We have to breastfeed the baby when the baby requires, when the baby demands it. That time only we have to breastfeed the baby. Next step is there should be no giving of artificial teats or pacifiers to the breastfeeding infants, because it will be causing infection. It will be causing some oral disorders to the baby. Baby won't be liking this breastfeeding. Baby will be attracting more toward bottle feeding. So we have to avoid this giving of artificial teats or pacifier to the baby. And the last step is we have to foster the establishment of breastfeeding support groups, and we have to refer the mother to that group when the mother is getting discharged from the hospital or clinic. So this breastfeeding support group, what it do, it gives positive attitude to the mother. Further, it will provide psychological support. It will educate more mother to have exclusive breastfeeding up to 6 months, and this is compulsory only. Then this BFHI is active in India under National Task Force, which is comprising Government of India, WHO, UNICEF, voluntary agencies, and many other professional bodies. Now, how will get the recognition of baby-friendly hospital? How a hospital can get the recognition of baby-friendly hospital? So there are 3 steps. A hospital can get baby-friendly hospital designation. So first step is this hospital should conduct at least 250 deliveries per year. After conducting 250 deliveries per year, after completing this criteria, a hospital must have implemented this all 10 steps to their hospital. They must have institutional ban toward bottle, teats, pacifiers. They should not be supplying any low-cost milk substitutes. Then they can send a self-assessment form and registration form to BFHI secretary. Further, second step is this: the hospital must be visited by assessor in order to see the on-spots, like if they are following the policies, and then they'll ask on-spot questions to the mothers, to the healthcare staffs. And then the assessor will send their reviews and observation to the review committee, and they'll review it and they'll give final recommendation. And the third step is, if a hospital is getting recommended by reviewing committee, then National Task Force will organize a public ceremony in order to give certificate and logo to that recognized hospital, and then that hospital will receive this designation, baby-friendly hospital. Suppose if any hospital is not receiving this baby-friendly hospital designation, so they can come, they can reapply this designation later after eliminating all the shots. So today we had seen about baby-friendly hospital, when it is launched, by whom, and what are those 10 steps, what is the current statistics, and then how a hospital can get recognition. Thank you. This is Yashika Gupta signing off.